Assalamualaikum. My name is Sadamjad and I am here to discuss test tube baby. What is the definition of test tube baby? It is also called a in vitro fertilization. In vitro fertilization is a process of fertilization where an egg is combined with sperm outside the body in vitro. By 2016, some 6.5 million babies had been born using in vitro fertilization. Steps of test tube babies: suppressing in the natural menstrual cycle, superovulation, retrieving the eggs, embryo transfer. Procedure of test tube babies. First is the suppressing the natural menstrual cycle. The woman receives a drug, usually in the form of a daily injection, for about 2 weeks to suppress their natural menstrual cycle. Superovulation. Fertility drugs contain the fertility hormone. Follicle stimulating hormone are given to the woman. FSH makes the ovaries produce more eggs than usual. Vaginal ultrasound scan can monitor the process in the ovaries. Procedure of the test tube babies. Third is the retrieving the eggs. The eggs are collected through a minor surgical procedure known as a follicle aspiration. A very thin needle is inserted through the vagina and into an ovary. The needle in which connected to a suction device dissects an egg out. The process is repeated for each ovary. Frozen or donated eggs may be updated. Fourth is the insemination and fertilization. The eggs that have been collected are placed together with mate sperm and kept in an environmentally controlled chamber. After few hours, the sperm should enter the egg. Sometimes the sperm is indirectly injected into the egg. This is known as a intracytoplasmic sperm injection (ICSI). Frozen sperm retrieving through the testicular biosphere may be used. Fifth is the last, which is embryo transfer. Sometimes more than one embryo is placed in the womb. It is important that the doctor and a couple wishing to have a child discuss how many embryos should be transferred. Normally, doctor will only transfer more than one embryo if no ideal embryos are available. The transfer of the embryo is done using a thin tube or catheter. It uses the worm through the vagina. When the embryo sticks to the lining of the womb, healthy embryo growth can begin.